So first of all, this is what I'd like to start with is, and I'm just going to reflect back on a conversation I had last week with um, somebody who has been representing disability cases for 16 years. She actually worked for the Social Security Administration. And I had a conversation with her, Mark, and she did not understand Medicare. Like Medicare, she knew there was A, B, C, and D, but she didn't understand the breakdown, like what A and B covered. She didn't understand what Part C was, that there was a Part C. She thought everything jumped to Part D. So let's just start with the basics. Like if you could, a brief explanation of A, B, C, and D, that would be great. I don't. The reason why is I don't want to presume anybody out there understands based on what happened to me last week. Make sense?
Right. Yep. Makes total sense. So Part A is, well, first, the original Medicare is Part A and Part B. Part A is the hospital side of Medicare, and a lot of people think that Part A covers everything that happens when you're in the hospital, but that's not true. Part A is really more of a facility fee. It's your right to be in the building, use some of the services, those sorts of things, but it doesn't cover any of the medical care, and that's all covered under Part B. So Part A covers inpatient hospital for the facility fee. It also covers skilled nursing, a skilled nursing facility if you have to go to a rehab or skilled nursing facility after you leave the hospital. And Part A also covers some home health benefits. Part A for most people is an entitlement, so there's no premium. They don't have to pay anything for it each month, and so it doesn't cost them anything. Part B is the medical side of Medicare, so that covers everything related to diagnosis and treatment. So that would be doctor's office visits, surgery, blood work, labs, all those sorts of things. And there is a premium for Medicare Part B for most people. Most people in 2020 will pay $144.60 each month, which is automatically deducted from your Social Security income. If you're not paying, or excuse me, if you're not drawing Social Security, then you have to cut a check quarterly to Social Security. If you make above certain income thresholds, you'll pay more than $144.60, and if you make below certain income thresholds, you will pay less than $144.60.
Mm-hmm.
Now, I'm going to skip ahead to Part D. So Part D is the prescription side of Medicare. So that, so Part A and B do not include prescriptions. So Part D is a standalone prescription drug health plan that you would pay a premium for. Of course, if you're receiving Medicaid or other financial assistance from the state or federal governments, you won't have to pay the premium. But most people will pay a premium for Part D. And then in addition to the premium, then they have co-payments for most or all of their prescription drugs. And of course, that varies based on the drugs that they take as well. Now what Part C is Part C is a combination of all three, Part A, B, and D. So you've got your hospital, your medical, and your prescriptions all rolled into one plan administered by a private insurance company but funded by the federal government. So rather than carrying your Medicare A and B card and carrying your Part D card, you would just carry one card for your health benefits and your prescription benefits, and that's all you need. And then rather than paying all the deductibles and co-insurances for Part A and B, now the insurance company will pay most of your bills, and then you have co-payments that you have to pay to cover what the insurance companies don't.
Mm-hmm.
Now Part C plans, which by the way are also referred to as Medicare Advantage plans, often include many additional benefits that original Medicare does not include. Some of those benefits, not always, but some of those benefits include dental and vision, an over-the-counter benefit where you can get over-the-counter items, a credit every quarter, every month for certain items that you might get over-the-counter at the pharmacy at no cost to you, a gym membership, transportation services. Some plans include meal services after you've had surgery, a nursing hotline, etc. A whole bunch of different additional benefits that original Medicare doesn't cover.
And so just to recap, A, hospital, B, doctors, testing, labs.
Anything that B is anything that the doctor needs to do to figure out what's wrong with you and then treat it, whether that's surgery or other types of treatment.
Right. And then jumping ahead, D is drugs, and then C is a combination of all of them with a bunch of extra benefits.
Correct.
Good. Okay. So that's the Medicare program and the benefits and the brief breakdown. Let's go through the eligibility. And I'm going to put up on my screen right now I'll call it the obvious population that is eligible for Medicare, and those that have reached full retirement age. So that would be one segment when somebody reaches full retirement. But there's a part that people don't understand clearly, which is the disability component, Mark.
Right. So the way that so there are basically two ways to get Medicare. The first one is to age in to Medicare. So people that are 65 years old and older, or they're retiring. You don't have to take Medicare when you're 65. If you continue to work, you don't have to take Medicare until you decide to retire. You could be 95 if you want. But so that's obviously the biggest group of people that are eligible for Medicare. But then there's also people that have been deemed disabled and unable to work by a court of law. And those people at that point begin to receive Social Security Disability Insurance, SSDI. And once they've received 24 payments of SSDI, then they automatically qualify for Medicare. And in some cases, there's a waiting period as well. But sometimes they receive all of those SSDI payments as a lump sum because it just depends on the onset date of their injury or illness. But people that are disabled after they've been disabled for a certain period of time are then automatically eligible for Medicare.
You know, you said something that I really liked, which is after 24 payments, you become eligible. That is a very easy way to explain it, rather than, you got, because there's a lot of variables involved, but thank you.
Yeah.
That's good.